I had signed on online, but an occasion like this is one of the things that got me out of my hermetically sealed office during this. So I think it was more special for us to be together in person. This is one of the few meetings that we've actually had in person around here, but it's for a really special occasion. Really excited, and after some delay because of COVID, which has delayed just about everything normal around here, we are getting back to recognizing our physician and advanced practice clinician of the year here at the hospital. We had this ready to go back in February, and then again, everything was delayed. I think, so this is I just in April had my second year anniversary as the CEO here. And one of the things that I continue to be impressed with here at Rutland Regional is the strength of the culture. And the other thing is the strength of the medical staff here at the hospital. Tremendous providers, tremendous culture, and tremendous amount of respect for the work that our physicians and advanced practice clinicians do here for patients and for all of us here at the hospital every day. We had a record number, even though we were kind of getting into the COVID pandemic when we were doing the nominations. We had a record number of nominations. A lot of people had recognized their provider, and then we went through a process where we selected two who we thought were the best of the best. And I think also the other thing is what we are seeing with this pandemic is the importance of healthcare and the importance of people who dedicate their lives to medicine during this crisis. My hero, all this pandemic, is Dr. Anthony Fauci, a physician who spent his life at the National Centers for Disease Control and has been a guiding principle and guiding force for our country in trying to help us navigate this time in our lives that I've never experienced, and probably no one in this room has ever experienced anything of this nature. So I think this is healthcare's finest hour, and I think this is physicians and healthcare providers' finest hour in this country. So with that, on a local level, this is your finest hour. Thank you for the work that you do every day, day in and day out. Thank you for the sacrifices that you have made, probably from the time you were growing up in grade school, planning for the day that you would get into med school, get into advanced practice clinician school, get your training, sharpen your skills, and then take care of people. So I want to thank you. I'm honored to be here. As medical staff is one of the things that makes this hospital great. So congratulations. There's a couple other people here who want to say a few words to recognize you, and thank you very much for your service, and congratulations. I'm glad we could be together a little bit for this celebration. Thank you.
Oh, hi. I sort of echo Claudio. It doesn't feel right to do this behind a podium. It seems like we should be doing it in a big group, and it is a little bit tragic on that regard. There's a lot worse things going on, obviously. I do apologize that it has taken us 3 months to decide what to do to celebrate our Physician of the Year and our NP and PA of the Year. I just sort of been reasonably optimistic that this might sort of blow by and work itself out a little quicker, and that we would be able to have a more traditional celebration. This is generally done these awards are generally given at a celebration of excellence among the entire medical staff, and that includes recognizing the nominees. This year we had 36 nominees, an unprecedented number, and really, to me, gratifying. That shows that our physicians make an impact on the staff, they make an impact on each other, they make a big enough impact that people on the staff, people in the community, and their colleagues are willing to nominate them for this award. And And again, that's the highest number we've had. We've seen it continually go up, and we're super pleased. I'm super pleased to celebrate that and celebrate everybody who gets nominated. Our former winners, Dr. Shapiro's here, and Laura Cohen's here. Who is it? I think that's probably it. But anyway, this is not a minor achievement. It's actually a wonderful achievement, a wonderful recognition. I had prepared a long list of comments and fun things about Suzanne and about Jackie, but I was usurped by folks that work with them telling me that they really wanted to do that. So I'm going to which I think is great recognition for them as well. It shows that they're making an impact within their team. So Rick, why don't you come up and start? Sure. And Suzanne, congratulations. The fact that we're not doing this at a more joyous, big celebration doesn't hopefully belittle it at all. It really, again, thank you.
So, for those of you who don't know Suzanne is an absolutely fantastic doctor. She's one of the best doctors in this hospital. And the most commonly heard thing I hear about Suzanne is she's the kind of doctor you'd want to have your parents see. If ever you have someone, a family member, loved one who's sick, many times, especially if it's a colleague, we'll get a phone call and they'll ask, "Oh, who's on?" And if Suzanne's on, the answer is always, "Oh, I want Suzanne." And if she's not, they ask if she is. It's such a privilege to work alongside such a great team, and I'll tell you, with someone like Suzanne, it's sometimes challenging. So the great things about her is she's such a great physician that you are confident that she's going to take excellent care of anyone she sees. The hard thing is it's hard to live up to her standards. When she does an assessment, she looks over every stone that there is to roll over and looks at every single possible condition. Her write-ups are the best, bar none, and it's what we all look to when we're looking at someone's past history. So really one of the best clinicians I've ever had the pleasure to know, and would be happy to have anyone in my family cared for by her, although I will say we all struggle living up to her standards sometimes because they're so high. The other thing that we sometimes struggle with is, as you know, we don't stay on, every single day. We do change hands. And I'm very appreciative that I'm not on the same team as Suzanne, because I know that the folks who take over after her, the patients are often asking for her after she's gone, because she's just such a great clinician. So I didn't have too much to say. I just wanted to say, Suzanne, we think the world of you. You very much deserve this honor. I think anyone who knows you appreciates that and sees that, so congratulations.
Jackie, I don't know why why the selection committee, which is this vague committee that's distant, picked two of the most fittest people as well. I think, typically there would be cake and maybe even some adult beverages in the back, but today we've got bananas, apples, and clementines. So, Jackie Becker is our NP/PA of the year. This year we also have had a community primary care provider NP and PA of the year and physician of the year. And although Jackie is the NP and PA of the Year for Rutland Regional Medical Center, she could also be it for the community. She is an incredible resource to the community. I didn't realize, but had been in the emergency room back in 1998, then as a nurse practitioner, then left for 15 years, and then has been back with us. But really, during that 15-year time, provided the community with primary care. And she is viewed by a huge number of our employees as the resource for primary care in their lives. And Brian was going to make some nice comments for us as well. So,
super.
Thanks.
Thank you. Righto. I could speak forever about Jackie Becker, so I will. Anyway, Mel hit on a couple key points. So, and this comes from Jackie's staff, but I think Jackie maybe coined it. Every employee is her patient. And I know many of you in this room have kind of filled those shoes, I think, and been her patient at one point in time. So, 5 years ago, Jackie was running what used to be the employee health / occupational health office for RRMC. Didn't turn out to be such a great business model and so forth. Jackie took the chance to redirect energies and really create what is today's Employee Wellness Center, which to this day I still don't feel we market enough, although we're busy as heck, I know. But I still run into employees that say, like, God, I went over there and I had a strep test or a flu test, and I didn't have to see my PCP, and I didn't have to make an appointment, and I wasn't even charged for it, and that's great, So it was really good. I credit Jackie for so much of that. And she, one of her claims to fame, I describe as the Roots of Resilience Wellness program we have, and four in particular, the emotional, physical, spiritual, and financial roots. And Jackie created programs that covered all of those with helps of teams that she works with and so forth. But she really was all about addressing any kind of condition that could impact an employee's health. And it might be stress about money, it might be stress about things going on at home. And if she couldn't help them directly, she knew exactly who to link them up with. And sometimes it was other resources here. And as Mel said, sometimes it was resources that existed outside of these four walls too. So she really did care about the employee's total wellness, and it really showed. And I know that loads and loads of employees wrote feedback into the committee that made the choice for Jackie, and I think the outpouring of support is definitely warranted. Sorry. So last but not least, thank you for all you're doing and for all you've done for me. And again, just to say it, every employee is your patient. And thank you.
Well, all these years of trying to be more like Dr. Shapiro have finally paid off. But I really, I'm quite honored and shocked when Mel sent me an email. He did put in all good, but I wasn't really sure what that meant. I thought,
when I said call me,
perhaps, I was like, am I getting fired, or is it an opportunity to explore new ventures? So I really appreciate this. I came to Rutland as a locums, and I hesitated over agreeing to stay for 2 months, and that was 17 years ago. So it's really, all along I've been helped by so many people, other physicians, other colleagues, but case managers are always guiding me, social or physical therapy. It's really a wonderful place to be, and as mentioned earlier, the culture is really geared towards doing what's best for the patient. So I really appreciate that, and I'm really inspired by this and hope that I can live up to this award. So thank you.
Jackie, you have some words?
I think I'd just like to say that I'm very excited that wellness is important enough that so much of the staff felt that they wanted to recognize the department with this award. I appreciate that, and I appreciate the team, the wellness team that's worked on the growth of the Wellness Center for the last 5 years, and particularly I see increasing leadership involvement, which is huge, and I think we're really fortunate to have this organization. The leadership in general gives such support, and Brian in particular, and I think it's very exciting to have a wellness person recognized, so I appreciate that.
As Claudio mentioned, I think that healthcare is a great and rewarding profession, and those of us that got into this line of work did so for a reason. But a lot of years that work sometimes goes unsung. And during this COVID pandemic, I think there's been a greater awareness of the folks that have dedicated their lives to caring for others, what heroes they really are. And I'm really thrilled that the hospital decided many years ago to set up this award so that even in the absence of COVID, we'd have an opportunity to celebrate excellence at least once a year. And these two recipients are certainly well deserving of these awards. I just wanted to say a couple more words about each of them in my capacity as medical staff president. That's the good part of the job, is getting to do things like this. Suzanne, as we know, has served as a hospitalist since joining our RMC in 2003. Some of the comments from her peers highlighted her clinical skills, her thoroughness, and her dedication, as Rick also mentioned, and also how accessible she always is to patients and their families, which is an important trait. In my own interactions with Suzanne, I've always been impressed with her knowledge, her pragmatism, and also her positive attitude. Suzanne's someone who's always quick with a smile and a laugh, and I think finding a little more joy in work is always a wonderful thing. It's easy to get cynical and burned out, but Suzanne is clearly someone who's not only excellent in her skills, but still clearly enjoys her role in caring for others. Jackie, I've had a chance to get to know a little bit better in the last year or two through a couple of projects we've been involved in. As Mel mentioned, she's worked in a variety of capacities since first starting in the ED back in 1998, and most recently as Director of Employee Wellness since 2014. Her co-workers have highlighted her leadership by example, her empathy and attention to the needs of others. And as Claudio pointed out, those of us that have been on the receiving end have found that out to be true firsthand. Jackie's been instrumental in advancing a culture of employee wellness through her one-on-one interactions, as well as fostering partnerships with community programs like Habitat for Humanity, the Veggie Van Gogh program, and others. She's also been an important partner in the Provider Wellness Committee, which I think is another really important source for all of us of strength and support. I can personally attest to Jackie's commitment to promoting wellness in a very holistic way. As Brian mentioned, this encompasses both traditional medical care, but also the importance of nutrition, exercise, mental and emotional well-being. So on behalf of the entire medical staff, it's my privilege to extend our heartfelt congratulations on being named the 2020 RRMC Physician of the Year and Nurse Practitioner of the Year. Thank you very much.
Good afternoon, everybody. For those of you who don't know me, I'm Don, I'm the CEO. It's a privilege to be here today to honor these two fine providers. You know, when I came to Vermont, I came from systems that were basically churn and burn on the patients. We tried to get as many through as possible. It's different here. This is a place where the community and community health really matters. It's not just providing medical care, it's being an advisor, it's being a counselor, it's getting to know your patients and following them through their lives. And I cannot imagine the devotion that these two gentlemen have had to this community. It's outstanding. And we are honoring them today, but it's typical of everybody at Community Health. That community sense, that giving is something I love and something I have learned that we have to cultivate and keep intact. So, Dr. Dirksen, Mr. DASHNAW, thank you for everything that you've done here. Thank you for all your work. It is an amazing thing, and this award is truly deserved. And I'd like to introduce the CEO of Rutland Regional Medical Center, Mr. Claudio Fort.
Thank you, Don. On behalf of Rutland Regional, this is a first. We have been doing a Physician and Advanced Practice Clinician of the Year for quite some time. This is the first year we have gone out and solicited nominations for community providers as well. And it's really important. Talking to Dr. Dirksen just before this, we started. When he started out, as most primary care physicians back in the day, they saw people in inpatient and outpatient in the hospital. It was before hospital medicine services and so forth. And there's been a lot of benefits to splitting those up. You know, both of inpatient and outpatient care becoming more specialized, but we also lost some continuity and some connections from those changes. And a lot of times, we don't see our primary care providers as closely, as much, and as frequently as just some of those hallway conversations when you're both rounding on a patient and so forth. So this is one measure to do two things. One is to reestablish those critical connections with primary care. The hospital, although we don't employ any primary care, and most doctors are employed now, we could not survive. We would not be a hospital without primary care and without the strength of primary care base. So it is a really honor for us to be able to honor two incredible leaders in the primary care who have devoted a tremendous amount of their lives to the patients of this area. We can't thank you enough, and we can't think of two better representatives to be the first winners of the Primary Care Award for this. So thank you both very much. Thank you for your ongoing service. We're very grateful and very proud to have you listed in the hospital and to reestablish this connection. So thank you. And I will turn it over to Dr. Boynton, who needs no introduction.
Oh, thanks. I feel like the governor. You get to walk up and take your mask off. Thank you all for being here. And this is a special award, and it generally goes with a celebration of excellence for the medical providers of the region. And I feel terrible that we've had to waylay that this year. It's normally a social event. We get together and celebrate doing good. And so thank you for being here to celebrate doing good. It really is great. One short story. When I arrived in town 22 years ago, different color hair, and I met the providers at Vermont Orthopedic Clinic. There is a physician's assistant there, Jim Hollinshead, and he sort of grabbed the list of all the providers, and he kind of went through and gave me the down low on physicians and NPs and PAs throughout the Rutland area that I might get referrals from. And we got to Pete Dirksen's name, and he said, now, he has a huge practice, rarely needs your help, but when he does, he really needs it. So be really responsive here and you know, if he calls, it's serious. Pay attention to that. And then we kept going, and we actually probably hit DASHNAW first. I'm guessing it was in alphabetical order. And he said, now, Mike DASHNAW, now, he has so much experience that he's never going to bother you. He's never going to call you. And if you have questions about orthopedics and how to care for it out in the western edge of the state, you call Mike. So in any event, that's where we are. Again, we're very fortunate to have a great team, and I view primary care, although we're different organizations and different groups, I view primary care through the specialists and beyond, even to our tertiary centers, as all of us as a team. This is, when you're in the midst of a pandemic, that team really matters a lot more than it does when you're not. And I think there's been a great demonstration of that throughout. So, Brad, if you want to come up and introduce, that would be wonderful. Thanks. And by the way, if any of you have a secret and you want to maintain that secret, Brad Berryhill is your person. So we have known about the recipients of these awards. And by the way, there was a pile of nominees. But we've known about the recipients of these awards for 3 months now. And I called Brad right when we got the letter from the Academy and opened it up and found out who was going to win the awards, and called Brad and asked him to keep it confidential. And unbelievably enough, it's remained confidential. So, Brad, thank you.
You know, as physicians, we have a lot of secrets. My voice does not project very well, but can you hear me? Okay, great. I'll try to speak up. So fundamentally, I want to introduce Mike and Pete, but also I wanted to sort of open up this sensibility of the karma here of gratitude. And that to me is the most important role that I can play right now, introducing these two gentlemen, and that we are all so grateful for your presence, for your guidance, for your collegial relationships, for the care of the community. And I just wanted to express that and to sort of open up that part of the karma here, because it's so important. I also want to make it a little easier for you both to come up here and say a few words and make you comfortable in front of the podium, because I know it's so difficult to do that. And I've been doing this kind of thing for a while, and I always remind myself, well, what do you need to do when you get up here? Well, I think it's important you want to thank some folks. You want to thank the audience. You want to thank your spouses. Well, I don't think you're here today, but I'm sure you both will. Your family, your parents, wherever they are in the universe, are looking down today and saying, oh my God, I'm so proud. Oh my God, look what I've created. And I will thank your parents, wherever they are in the universe, for creating the individuals that you are, and thank you for the contributions you made to our community. So I wanted to kind of do some pre-thank yous for you. And I also want to thank Rutland Regional for opening this recognition, this award to the community. This is not about community health per se. This is about our community here in Rutland. And I kind of have a sense what the secret sauce of selection is, but it's a secret sauce. I don't really know. But whatever the secret sauce was, you guys nailed it. You guys at Rutland, you nailed it. It was just perfect. I couldn't think of two better individuals to be the first recipients from the community. And I thank Rutland Regional for opening this up to the community. And again, this is not a community health event. This is a community event. And this is why it's so important. I want to add a little context to to this moment. And I could have this wrong, but I'm thinking between the two of you, the years of experience here in Rutland County's 80 to 90 years experience between the two of you. And the quality is just, every year just increases. It's just amazing. So think of that, 90 years of experience with high quality, just amazing. It's beyond anything I could really put in words. I just want to put that in context. From the role of our patients, you know, we part of the role in primary care is we guide, we help people make difficult decisions, and sometimes we initiate the treatment, but a lot of times we're there just to say, hey, think about it this way, think about this perspective. And I just want to thank you from the perspective of your patients, both your patients, of all of that guidance you've provided them over the years. This hard decisions they've had to make with their own health, their family members, et cetera, et cetera. It's been remarkable. And I want you to know the appreciation from your patients that I hear every day about both of you. And you should understand that, and don't forget that. Your patients really appreciate you, and the community does too. Collegially, what can I say? There's nothing more valuable in my life than having worked with both of you. I could call Mike any day of the week, and I say, Mike, I need you to think about this or do something. I'm on it. Well, can you say, no, I got it. And you know what? I don't even have to think about it again. Mike's got it. Pete, oh my God, what can I say? You know, I'm always in his office. Pete, what do you think about this EKG? What do you think about this X-ray? This is a funny looking lab. What do you think? What do you think? Can you see this? You know, I can't thank him enough for being such a valuable colleague. I'll give you a quick story. It was probably late March. We kind of cohorted, segregated our patients, but ourselves, and I asked Pete to go home for a week, which he did not want to do. And Pete and I kind of camped out in express care for about a month. Pete comes back the next week and says, don't ever do that again. I'm not going home. COVID comes about once in a career, and I'm not going home. I'm staying right here. He never went home again. That's the kind of person he is. Well, that's why we're here today, because we all get it. And what I have to say to you is what we all want to say, is that we understand the time and the stresses and the commitment, not only from yourselves but from your family. And we want you to feel and understand our sense of gratitude for all of the effort and all the commitment and all of the work that you have dedicated to all of us in our community and our patients, and all the extra stuff, Mike at school and Pete at the football and basketball games, and and the countless times that we don't even know about, the little things that you did in these communities. You think we don't know, but we actually do know, and that's why we're here today. And so, what I want to do is express to you is that sensibility of karma and our sense of gratitude for what you've contributed and what you mean to our community and what you mean to us personally. So thank you from all of us. And I'll introduce each of you individually. Mike, you want to come up first? Say a couple words.
Do I have to talk?
You don't have to say a darn thing.
I don't have to say a darn thing. No, I really feel honored and very humbled about this. I don't know what to say. I am blessed to be able to do what I've loved and actually get paid to do it. So, thank you. But first of all, I just wanted to thank the selection committee for choosing me. I really appreciate it. It's quite an honor. I also like to thank the people that nominated me for this. I'm not sure who did that, but I appreciate it. Michelle. But it's been an honor to serve this community for the last 38 years. I really enjoyed it overall. It's been very fulfilling for me. I met a lot of great people here at the clinic and helping them with their healthcare needs. It's been very fun to do. I've been fortunate to now take care of 3, even 4 generations of family. That's been really very fulfilling for me. As Brad mentioned, I really have enjoyed working with the sports program at Fairhaven Union High School. When I first moved here in 1982, I asked the head football coach if he needed a team physician. I know he didn't have one. He really wanted one, so I agreed to it. And I've been there on the sidelines for the last 38 years now. And I also go to the basketball games too, and that's been a lot of fun. It's also been fun watching the student athletes become older, get their own families, and watching their children play too. So that's been very fulfilling for me. I've especially really enjoyed working with the staff here, both past and present. I've really always been very impressed with the staff here. I think they're very professional. They do a great job. They really care for the patients. I really enjoyed working with them over all these years. So that's been really, and that goes for everybody, whether it's the providers, the nurses, clerical. I've just been really impressed by everybody. So it's been a lot of fun working with them. And I especially appreciate Michelle, who's put up with me for over 30 years now. And I think we have a good relationship, and that's been very enjoyable. Yeah. Part of what has made my job easier is a specialist in Rutland. I really appreciate them. If I have a problem, I call them up, whether it's ortho, cardiology, radiology. They always come to the phone and help me. And that's made my job a lot easier, and has also made, I think us in primary care really appreciate the excellent specialists we have in Rutland. So that's been really good for me and everybody else too. So again, I appreciate this award. Thank you very much. Thank you.
I think everybody here can see how touching this is for the recipients and for all the providers, frankly. And so next year, when the nomination forms kind of come around and stuff, don't be afraid to grab one and help make the selection by the secret society more valid. And so thank you all for being here, and thanks to our recipients, and thanks for all you do every day for our communities. Thanks.